Hello, everybody. Sorry, I'm about a minute late. Yeah, sorry about that. I was trying to send back some messages of people who had sent me out some birthday wishes today. So let's see. So I should start off with my name is Laura Russell. I am healthy carnivore. Today is my birthday, and I'm 54. So I've had my birthday sang to me a lot today, and I had a massage. So it's a great day. Got to see grandkids today and my daughter. So it's been fabulous. So a little bit about me is I do the Lion Diet Keto Carnivore. I did keto for 28 years and then 6 years ago transitioned over to carnivore. 3 years ago transitioned to Lion Diet. Um, so that's kind of a little bit about me. I am a registered nurse. I do home health nursing right now. Um, and I've been a nurse for over 22 years. So seen a lot of stuff, some good, some bad, but it'll get good again. I think we're going to get back to the old style of doctoring and nursing. Just my opinion, but I think it's coming back instead of the type that we've been seeing. So let's see. Renee says, well, shoot, I thought this was the tinnitus one. That's next week. Next Monday will be tinnitus. That's good. Yeah, there's actually a lot of people. There is almost as many people taking acid blocking medications as there are taking statins. Tara, hello. Was thinking you were not going to be on tonight. No, no. I don't miss Monday night lives. I've never have. I didn't last year and I won't this year unless I'm in the hospital, I guess. But otherwise, no. Let's see. Sina says, happy birthday. Oh, thank you. Thank you. Thank you. Let's see. So I'll jump into this tonight and go over everything with you guys. Let's see. Because I had done something about these medications. I didn't really go as in depth as I needed to. So I've had some people kind of ask for this. So that's why I'm going over it. So if you go back through my videos and you're like, hey, you did one on PPIs, this is going to be much more in depth. Um, so acid blocking medications are two classes. So they're PPIs, that's proton pump inhibitors, and that's H2 receptor blockers. So they just block the receptor site, the H2. Anticholinergics is basically another class. Anticholinergics can be very dangerous, especially with elderly. And I see a lot of elderly people being put on anticholinergics. So, not just acid blocking medication, but most of your medications that are for bladder leakage issues are also anticholinergic. Very serious fall risk, dizziness, low blood pressure, blocks calcium absorption. There's a lot of stuff. So when I see an elderly person on it and they're like, I'm dizzy all the time, and I'm like, and they're not taking blood pressure medicine and they don't have a low blood pressure, I'm like, I think I know why there might be something. So that gets a note sent to the doc like, hey, this person's a fall risk. They've had several falls. They're dizzy and they're taking, this medicine and this medicine and this medicine, and they're all anticholinergics. Is there another option? Is there something else we could try holistically and natural? And sometimes I get a yes back, and sometimes I get a they need to stay on that. And then I just tell the patient, you have to decide what you want to do with that information. They make recommendations, they do not make the law. So, one of the biggest things with these medications, and now I'm talking about the acid blocking medications, is that they really, really cause nutrient deficiencies. Okay. So, they reduce the stomach acid, which then is going to impair um, the absorption of your nutrients because magnesium, calcium, vitamin B12, iron, all of those are broke down at the stomach and small intestine level. So when you have acids decreased, you're not breaking down those foods and getting those molecules broke down so that you can get those ingredients put out to the rest of your body. So that can lead to anemia, muscle issues, but I'll tell you the number one thing I see with people, osteoporosis. So, because it affects the calcium absorption. So, that is probably the biggest one that I see that is long-term serious, you know. The other ones you can do some things to get around. Um, Increased infection risk. So, low stomach acid reduces the barrier, against pathogens. It increased the risk of gastrointestinal infections, such as C. diff and respiratory infections as well. And that's just because what's in the stomach rides into the esophagus and can easily get over into the lungs. Happens a lot. Another thing that it can do is kidney issues. So, very long term use, anything over 6 weeks. You really, originally, when these medications were brought out, it was 2 to 4 weeks without medical like guidance, and 6 to 8 weeks with medical guidance. And now there are people that are on it for 3 or 4 decades. These PPIs have been linked long term use, like I said, over 8 weeks, 6, 8 weeks, to chronic kidney disease and acute kidney injury. Um, Acute kidney injury, if you stop what is causing it, you can recover. It is a very long process. It takes a long time for the kidneys to rebound. They will if you're doing the right things, but it takes a long time. Um, Another thing is gut dysbiosis. So that is where the altered acid levels can disrupt the gut biome. So that's the good bacteria and bad bacteria. You kind of need a mix of those. You don't want too many of the bad, but it can lead to overgrowth of harmful bacteria such as SIBO, SIBO. Definitely look that one up. Very big with these. Hello, Dawn. How are you? Thank you for the happy birthday. So the gut dysbiosis is major as well. I have seen people who were told they had acid reflux, put on these medications, and within 2 years they have a ulcer and they have H. pylori. If I had 50 cents for every person who's ended up with H. pylori breaking out of their stomach, we all have H. pylori. It's supposed to be inside the gut and stay there. Um, I would be wealthy. I wouldn't need to do either of my jobs. Rebound hyperacidity is sudden discontinuation, can cause a significant increase in acid production, worsening the symptoms. So that is where when you stop them, that you don't have something to help get your stomach acidity back up, that it's very hard because you've told those pumps to quit working. Those pumps were put there to do their job, and now you've been taking a medication to tell it not to. Same as insulin for a type 2 diabetic, taking insulin, your endocrine system is like, okay, I'll take a break. Same as thyroid medicine. If not that you don't need it sometimes for a while. If you have no thyroid hormone, that's another thing. But a lot of times you can heal that and get better. Multiple things like that in our body. That when we take these things, we're telling our body, hey, we got it. We'll just keep buying pharmaceuticals to take over what the body's supposed to do. So this is probably one that you guys maybe have noticed out in your family or people that you're around. Blocking acetylcholine. Many of these medications, such as PPIs and the anticholinergics, block acetylcholine. So, acetylcholine is in the stomach, but it's also in the brain. These medications, just like statins, cross the blood brain barrier. They don't need any assistance getting across, they cross it. So, acetylcholine is also a neurotransmitter in the brain. So I've had people who were like, "Yeah, I'm starting to get brain fog," and they're eating primarily healthy, and they've been on a acid reducing medicine for 20 years, and I'm like, "Maybe you should try some apple cider vinegar with the mother in it and see if you can wean yourself off of it," and they all have, so. Memory and cognition. So acetylcholine is crucial for learning, especially memory. Attention, is major with that as well. Its inhibition has been linked to cognitive decline, dementia, and Alzheimer's disease. Now, I'm not sure if it's still out on the website, but Protonix, um, Prilosec, back when ranitidine was still on the market, because it was FDA approved and now it's not because of all the trouble it had. Um, but I'm supposed to run and take whatever the FDA approves right away. Um, but with that, um, we saw such a increase that they actually had to put it out on their page. So it did used to say that that medication, and especially in conjunction with statins, would lead to these diseases. It was on both the statins and on these. Not sure if it still is, but it was when I checked in 2022 still. Neuroplasticity. I think we've all heard that one. So, acetylcholine regulates brain plasticity, which is vital for adapting to new information and repairing the damage. So, we all know that we've been around these people who have like a traumatic brain injury, TBI. From a fall, they've had numerous like CTE, like football players, boxers, things like that, hockey players, even baseball players. All of these things can't heal if you're not letting the nutrients get there, and the acetylcholine and stuff like that. Mood disorders. So low acetylcholine levels can affect mood and motivation, contributing to depression and anxiety. Um, of course, the first thing I always tell people is to address the underlying causes of why they have acid reflux, if it's even really acid reflux, because most of the time it is a lack of acid that is causing the issue. It is not too much. And that comes from my gastrointestinal guy who has been teaching docs for the last 15 years at the University of Iowa. So hopefully those doctors are learning better than most. So this is what I would say. If you are, eating the proper human diet, um, and doing all the things, trying to correct these deficiencies, and you've tried apple cider vinegar with the mother, there are a few other natural things that you can do to help with this acid reflux and low stomach acid. So before I go to that, I just want to look and see. Hey, Darth. Hey, Charlie. Thank you. Let's see. Erica says, I have been keto carnivore for the last 3 years, under 20 grams, and okay, and often under 10. I test my blood glucose and ketones. My glucose was mid 80s and is now low hundreds. Why is my blood glucose going up? Your blood glucose is going up because of gluconeogenesis. So my guess is you might be doing a little more protein than your body needs. You may want to try to bump up and do more fat to your protein ratio, because if you eat more protein than the body is actually requiring, then the liver is going to convert that into glucose, any of that extra that's sitting around. So that's what I would try to do. Hey, Simpson, is it possible to test stomach acidity? It is. So I did a litmus type test. It looked like pH paper, and it's kind of the same way they tested for H. pylori. And so I did that, and then I actually did a spit test, and this would be, gosh, that's been close to 20 years ago. And I did a spit test. He didn't do a blood test he did for H. pylori, but he did not for the stomach acids. Really, most of the time, I think you're going to be able to know by what you are doing and what you eat and what problems you have. A lot of people don't realize that the sphincter at the top of their stomach sometimes gets weak. They could have a hiatal hernia, which is allowing the stomach to push up between the diaphragm and get up into the chest cavity. Not enough acid, and your food gets to the bottom, just doesn't want to be broke down, gets real dense, sits at the bottom of the stomach, and just sits there and rots basically. And then you're going to produce some acid, and it's going to sit on top because it's going to be more buoyant than the rotting food. And then that's going to easily come up, especially with the extra gases coming off of the foods, which is kind of like gastroparesis as well. Oh, let's see. Yes, Simpson, it is my birthday. Thank you. And thank you, Renee. Um, so some of the things that you can do is to stimulate natural stomach acid production before meals. You can look for like dandelion root, which I do dandelion root tincture. You don't have to buy it from me. You can go dig your own dandelion roots, dry them out, and make your own if you want. But dandelion root is something that you could do a tincture. I would probably do a tincture. Some people do the tea. You can do that as well. Just know that it's also going to help with inflammation, and you might pee a little bit more too. It's also very good for the kidneys. So those are called digestive bitters. So you can do that. You could do gentian root, which is another one that you could do. I have never used that one. I have used the dandelion tincture. That is what I have used. Another one, which a lot of you guys have probably heard of this one, it is the betaine hydrochloric acid with pepsin. So that's if you truly have low stomach acid. So you'll know eventually doing this. And like when you take these things, if you see no benefit, then it's not low stomach acid. You probably have you could have some people are born with their sphincter at the top of the stomach or the bottom of the stomach is not opening or it's too tight. It's stenosed and not doing what it's supposed to do. So there could be a couple different things. Aloe vera juice. I would have a hard time doing this being carnivore, even though it's for medicinal purposes. Um, because years ago I did a juicing thing many, many moons ago, and it had a lot of aloe vera juice in it. I suppose if I had to, I could do it because it's really good. It does soothe like irritated skin, so your esophagus, your stomach lining. So you could do it and it would help. It just is not something that I want to take in. Now, this one I could take in because I liked black licorice back in the day. So, licorice, which is I cannot pronounce this word. I'm going to try. So it is D-glycer. I don't know, licorice. So that's what we're going to call it. So that can help coat and protect the gut as well. Slippery elm or marshmallow root herbs. And so you could do that in like a tea. Um, if you're not allergic to tree bark, I cannot do slippery elm. So be very, very cautious. And again, I am a nurse, I am not a doctor. Just telling you these are the things that I have seen work. Zinc carnosine, which helps treat the stomach lining and it supports gut integrity. Melatonin, that it shows that it can help strengthen the lower esophageal sphincter and reduce acid reflux, especially at night. So if you're somebody with that at night, maybe give that a try and see if that works for you. Manuka honey, because of its antimicrobial and healing properties, and just a small amount before bed. And I am not the carnivore keto police. I don't believe that if you take a spoonful of honey, Manuka honey for healing, I'm not going to call you out and take your carnivore or your keto card. I'm just not. I think that these things are put here for us to heal and to use this way, and I'm going to do it. And if they don't like it, that's okay. Um, Another thing is meal timing and posture after eating. So, eating, you want to make sure you're chewing your food, which is a problem for me because I'm in a hurry. So, I'll chew, 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 and then I swallow. So, we need to slow down if you're having trouble with this. And chew slowly and make sure you're getting your meat or whatever it is you're eating broke down, and then not go lay down immediately, or slouch back in a chair, like sit up for a little while, or even better, go for a 5-minute walk. That is really going to help with you. Uh, so if acid reflux happens at night, you can raise the head of the bed a little bit as well as you're trying to heal from that. Um, so let's see. This one, I can give you a little bit of a protocol that I've used with people. Excuse me. So, um, supporting this is a 4-week type thing. Okay. So, the first week, what I have done with people is I have them start with digestive bitters. So again, okay, so like your dandelion. So that's 10 to 15 drops in a little bit of water about 15 minutes before you eat a meal. Optional if the bitters, if you don't feel like they're doing enough, you could get that betaine hydrochloric. acid and pepsin, and you could do one capsule mid meal. So, like you start to eat your meal and then you take it and then finish eating. Increase that up as you feel like you need to. I wouldn't go above three. You're going to do that for a week. This is if you've got really bad acid trouble. So, the second week, you want to soothe and protect the gut lining. So, that's where you're going to do like that licorice. You can do the 1 to 2 tablets 15 to 30 minutes before meals. They are chewable. You could do the aloe vera juice. That's from the inside. Okay. So, like, don't take if like I have a huge plant of aloe vera, I wouldn't take the whole plant if you're going to juice, if you still have a juicer, because we all did the juice thing. You just want it from the inside. So, you actually peel it and you can take like a spoon and run down in it and get that out of the center of it. Slippery elm tea or capsules you can do 1 to 2 times a day, especially good to take before bed. So the third week is when you want to heal and strengthen the gut. So this one is going to be the zinc carnosine, 75 milligrams, 1 to 2 times a day with your meals. You could do the manuka honey, and it says UMF and 10 plus or higher. So it comes in different grades. Like for wounds, I do 7 to 10. For this, I would do 10. You could do half a teaspoon before bed. Melatonin, probably 3 milligrams at bedtime. If the reflux is definitely worse at night, that's something that you could do. And then the last week, so the fourth week, do not lie down or slouch the last 2 hours, just within 2 hours of you eating. So try, like, say you go to bed at 9, I would absolutely try to have nothing in my stomach after 7 o'clock. Um, I would just try to give your body a break. Elevate the head of the bed 4 to 6 inches if nighttime reflux is bad. Slowly chew your food. And then it says also consider smaller meals. Now, when I first had really, really bad reflux back in the day, I was doing those 6 small meals a day, and for me, that kinda made everything worse because I was taking all these medicines to shut down my pumps, so I was having all this food sit there, and it just built up, and it was like, I could tell you that I could eat, a hamburger or some broccoli when I was keto, and it would sit in my stomach. It could be 2, 3 days, and I'm like, I'm pretty sure that is still sitting in the bottom of my stomach. Nothing had left. It was just there. So I do better with 1 to 2 meals and I eat till I'm full, but not to the point of where I feel like it's coming up my throat. Um, because I did have that very bad, as we can tell with my voice, between my asthma inhalers that I took for years before they knew that you were supposed to rinse your mouth out and do all those things. Um, those things kind of did this to my voice. So now I kind of sound bluesy, right? I didn't say floozy, I said bluesy. So let's see. I do see that I have a couple comments, so I will look at that before I tell you what we're doing for next week. This one will be fun. All right, so let's see. Gloria Jean Trainer just had to have my esophagus stretched. Oh, yes. So I'm sure they told you that that stretching of that stricture being tight was due to the acids coming up and burning that. Another thing that I will recommend that I have used with people that I've worked with client wise is making gelatin, like the old style gelatin in the orange and white box that you buy, no flavor, unflavored. I do like 2 cups of water and then like an electrolyte packet just for a little bit of flavor, like lemon, lime, or whatever, and make that up and then put it in a glass 8 by 8, like an old brownie pan, and then cut those into squares. And what I would also recommend is doing that, taking like a pretty good sized square, a couple of them, and doing that like half an hour before you eat. And that gelatin and that collagen is going to help kind of smooth and help with the healing of your esophagus. I actually had a gentleman who had swallowed I believe it was a vitamin, but it could have been a medication years ago. and it got stuck. It went below where it made him choke and it was stuck like here and it literally burned a hole in his esophagus. And he had that for years. It did not want to close up. And he did this gelatin trick where he would hold his in his mouth and he would lean because it was kind of off to the side and he would lean and just let that roll down. And it took some time, but when he went back to the uh, guy, the endocrinologist or whoever he was having do the scope, they said, "Well, you have a piece of scar tissue there now, but it had closed up." And I'm like, "Yeah, but as your body heals, you'll get better and it'll go." So, have had ongoing stomach issues for last 2 years. Tried all the natural things you mentioned. Even had blood tests to see what foods I had intolerances to. The scope shows scar tissue. They also took 3 biopsies both times. The last one was an a 326, haven't on 326, haven't heard back. Have follow-up with GI on 417. I did keto for a few years. Finally, after trying all natural things, agreed to scope, but I'm not in a good place now. So I and you've tried like what I would try is I would do, I don't know what diet you're doing right now, but I would really try to eliminate everything. I wouldn't do Um, I wouldn't do pork. I wouldn't do eggs. I really would not do dairy. I would do very low acid meats. I would only do beef, lamb, deer, bison, elk, bear, those kinds of things. I would do the lowest acid foods that you can. And then I don't know if you've tried that gelatin trick that I'm talking about. I really recommend I would have that every single day, several times a day, and see if you can get that healed. My other suspicion is that your gut bacteria is also off. So I would work on things of trying to get your gut bacteria built back up. So like kefir, drinking that, kombucha, things like that. Just a little bit of that to see if you can get that natural bacteria back in the stomach. Also, you would definitely be somebody that I would do a little bit of that honey and try to get that bacteria because it's good for that as well. That's what I would try. And then see if you get any benefits from that. Um, hey, yeah, you finally caught me live. That's good. Yeah, every Monday I'm on here at 5:30. So far I haven't missed one in a year, almost, let's see, a year and 12 weeks, something like that. So it's been a long time. But thank you for being on here. And let's see, Sina, what if you had the gastric sleeve done and you are 98% carnivore? I drink diluted teas, celery, and sweet onion. Acid reflux continues. I would say I would not be doing the onion celery thing. I don't think that would be what I would be doing because the celery with the uric acid. Um, I I would probably try some tinctures. And like I said, you don't have to buy my dandelion tincture. You can easily make your own. Just go out and get you some dandelion roots. Now's the perfect time. Dry those, and you can put them in a blender and get them blended up and broke down. You can make teas out of that, or you can put that in with really, really good vodka. Let that sit for 6 weeks in a dark place. Shake it every day. That will pull those nutrients out of that root into that, and then you can just do the tincture. That's what I would try. And even with the gastric sleeve, you can do fine. You can get past this having the acid reflux. I've had probably 30% of the clients I've worked with have had some form of gastric bypass, sleeve. They've had something. So, yeah, so true. Beef only, and that gelatin has helped. I need to use it more, so much better since I gave up bacon. I know, Julie, I know it sucks, but it is true. Just the lower acid that you can take in until you can get your gut healed is, yeah, yeah, very good. Oh, thank you for the happy birthday. Um, you're welcome, Gloria Jean. Definitely, definitely try that gelatin. Um, I really, really would do that and see if you can do a little bit more of like the lion diet version. Um, yeah. So yeah, and the problem is with any antacid, it's going to make you feel better in the short term, but the long-term effects of it is it's just going to cause issues down the road. I know it's at first. The other thing that you can do, and this kind of sucks, it tastes really horrible, but if you're having severe acid reflux, you can take like a 6 to 8 ounces of water and take half a teaspoon of baking soda and stir that in there, and it will be like putting a fire out, okay? It'll be like, psh, okay? It will be amazing. So you can also try that. My mother was a big antacid user her whole life. She does not ever listen to my advice. She always calls and asks for it, but she never does it. And she has a lot of issues with bone density, joints. She's got a lot of trouble. Um, She's got calcium where calcium shouldn't be. So let's see. But everything is hurting right now. So, Gloria, what I would recommend if those things are bothering you, I'm not sure if you've made bone broth, but that's another thing that you could do to get in some of the protein and the fat is to make the bone broth. It's going to be very healing for the esophagus and for the stomach. I would do that and little by little try to make like hamburger. And even if it's just 1 or 2 bites that you can get down, and then try to not drink any water, any fluids around your eating time, uh, just because it's going to mess with your acid. So, yeah, I have, although, two bone density. I'm not sure if you're saying you have low bone density or high. My mother's actually went lower by doing all those things. Some people, if you convert calcium over into your bone matrix and mix it in with, your phosphorus, magnesium, and all those things, that's good. But that's what I would try anyway. So for next week's video, next Monday, I am going to do a video on tinnitus. So that is that ringing, buzzing in the ears, and it is a very common dilemma. I have two clients, patients, home health patients, so not clients on my website that I have right now that we're working on getting that fixed naturally because the other stuff has never helped. Let's see. Bone broth. Yes, I am tolerating for a while. Good. I'm glad the bone broth. Um, and lots of pain. Yeah, and excuse me. Pain is associated with that, acid. Another thing that you could do to help with that is clove bud. Okay. So clove oil. You can take a teeny bit of that, like 1 drop of that clove oil in water and drink that, and that helps with that pain, okay? So, um, yeah, so that's good. Oh, yeah, by the way, Patrick, did you go lion diet? Because I feel like I remember you threw something out there that you were going lion. So I was just wondering if you have started your lion diet yet. So Gloria, yeah, low bone density, and that is due to things not breaking down properly in the stomach. So when you don't break those things down, they don't get out into the body and into the bloodstream and to where they're supposed to go. I do recommend that you take K2D3. Okay. Um, so that what calcium you have, you can get it pulled out of the places it shouldn't be, and you get that moved over into that bone matrix to get that bone starting to build because it will. I went from osteoporosis to I'm so far the other direction that I'm not sure. I have fallen many times and I have not broken anything in many, many moons. So let's see. Yay! Patrick is officially lion. Well, good for you. That makes me happy. I'm sure Dr. Hampton's like, yay. He's such a good guy. He's such a nice guy. I wish he was my doctor. If I lived closer, he would be my doctor for sure. Let's see. Bill says maybe too much water diluting your stomach acid, and it can be. That's why I definitely try to avoid drinking anything around mealtime. The only time I would do that would be a little bit of that dandelion and things like that, where I'd put it in a little bit of like a teaspoon of water and take that. Um, I mean, my husband loves the taste of dandelion root, so some people could probably just do it straight. I'm a baby and I probably couldn't do it that way. Simpson has been, oh, good. Simpson's been lying for 3 weeks. Yay. This is good. Makes me happy. Makes me very happy. So, all right, guys, I need to plug this in real quick because I don't know why I forgot. There we go. So let's see, K2D3 on Fragment heparin. So K2 is not the same as K1. There are at least 16 forms of vitamin K. So, like somebody who's taken Coumadin, warfarin, those types, we give K1 to reverse it in a shot. K2 is shown to not work that way. But if you have a question, I would ask a pharmacist just because they have a little more education when it comes to how those things work to see how that goes. So that is what I would do. So Bill says has tinnitus. Perfect. Next Monday, 5:30 p.m. I will be back and I will go over a lot of these things for natural treatments that we can do for tinnitus. So that is it for tonight. So I appreciate all of you guys. I'm going to go spend the rest of my birthday with my hubby and my cats. Yes, I am a cat lady. And crochet. I got a blanket that I've got to get done. The guy graduates this Thursday. And so I've got to get to crocheting my little fingers off. So let's see. Bill said he just did a 5-day fast. Oh, awesome. Good for you. I did a 36-hour. It'll probably end up being a 48-hour by tomorrow because I had a little trouble with my sinus after eating out on Friday. They didn't cook with my butter and they cooked with seed oil, so I did get some pretty significant symptoms from that. So yeah, so I'm fasting. Let's see. Thank you. I was taking choline recommended by chiropractor, but it is so large I can't swallow now. Yeah. Now, choline, if it's in a tablet form or if it's in a capsule, you can open that up. If it's a capsule, you can put it in water and drink the water. If it's a tablet, you can put it in like 2 ounces of water, let it set and let it break down, and it'll emulsify into the water and you can drink it. So if you were finding help with that, I would absolutely do that. You know, sometimes people with ox bile salts, same way, but you can open those up and just do it that way. So that's what I would do. Mhm. Perfect. Thank you. I am having a great birthday. Thank you, Bill. Thanks for the chat. Yeah, for fasting on my birthday. I know, crazy, huh? Um, It's not bad. It's okay. I feel so much better. I went and had a massage. She worked on my sinuses, and it was just this side, and feel so much better. I have learned that I will not go back to that restaurant because it has worked with me in the past to use the butter I brought, and this time they did not. They brought it back out to me. So after I'd already eaten half of my food, so won't be back. And it's too bad because I'm a really, really good tipper. I'm like 20 to the lady who takes our orders, 20 to the busboy, and 20 to the um, guys at the grill is what I usually do. And they got zero. So never again. All right. It's an oil gel. Okay. So just pierce the gel cap and just squeeze it in your mouth and take it that way. That's absolutely fine. Absolutely. So ox bile was my go-to for gotcha. So you do still make bile. The liver's still making it. You just don't have the storage tank for it to move over as fast, but it will get there. But yes, sometimes you do have to do a combination of those two. So anyway, I'm gonna get off of here. Thank you guys. I hope to see you guys next week. If you like this, please hit the like button. If you want to share this out to somebody you know that is having acid reflux, especially if they're having any of these symptoms that go along with long-term use of this, please share that out and subscribe. I think I'm a little bit over 3,000. So, which I didn't even know. I was at somebody's house and they were like, "Oh, you're at 3,000. You're big time." And I was like, "I'm not big time." And I was like, "I don't even know what that means." But anyway, so you guys have a wonderful evening, and I will see you guys again at least next Monday. I may come in and I need to do the one on the living will, power of attorney, and stuff like that. So I think I have a client on Wednesday that I'm going to work with, so it may be Thursday. So I may be here one other night this week. So I will check back in with you guys always. Thank you, and I will see you guys later. As I always say, meet, heat, eat, and repeat.